You've been dealing with horrible symptoms and you've heard that hormones could help, but you've also been told the very thing that could help you might not be safe. So which is it and what are you supposed to do? Somewhere along the way, hormone therapy has been labeled as dangerous. But what if the real risk is not understanding your options? If you're unsure about whether or not hormone therapy is safe for you, keep watching because today you're going to get some clarity about one of the most misunderstood and even feared treatment options for the symptoms of perimenopause and menopause: hormone therapy. There is no reason that your well-being, your sensuality, or your confidence need to change or disappear in perimenopause or menopause. You just need the right information to make the right choices for you to live well. I'm Dr. Janet, a board-certified obstetrician and gynecologist, a medical doctor, an intimate health and wellness coach, and hypnotherapist. I have over 25 years of experience working with women as a medical doctor in clinical practice. I now help women over 40 navigate perimenopause and menopause and get their pleasure, their intimate lives, and their relationships back on track. In this video, I'm going to be answering the question, is hormone therapy safe for me? I'll talk about what hormone therapy is, what it can help with, who should be using it, and who shouldn't be using it. And stay to the end to learn what women over 40 need to know about hormone therapy and improving and reviving desire and libido. Now, before I jump into the details, make sure to subscribe to this channel and share this video with someone who you know needs this information. When you subscribe to this channel, it not only helps you with the information that you'll learn here, but it also helps other women who need this information to find it and get the help that they need. Okay, so let's jump in. What exactly is hormone therapy? When we talk about hormone therapy, there are three main hormones that come into play, and that is estrogen, progesterone, and testosterone. Estrogen and progesterone are the two hormones that more healthcare professionals are familiar with. The main hormone between those two is estrogen. Estradiol is the form of estrogen that your body produces prior to going into menopause. Estradiol supports many functions in the body. It helps to regulate temperature, it plays a role in good sleep and mood, and it's an active part of mental cognitive clarity, maintaining vaginal health, reducing joint discomfort, and it's involved in cardiovascular and bone health. This is why estrogen therapy is a mainstay of hormone therapy for women in perimenopause and menopause, because it's involved in so many functions inside of the body. The main indication or reason for prescribing estradiol is hot flashes and night sweats, but many women report feeling improvement in multiple areas of their health and well-being because estradiol does play a role in so many bodily functions. So if you're a woman over 40 and you're starting to feel like your body is changing, you might be feeling hot all of a sudden, you might be feeling like your thinking is not as quick, like you're off your game, or you may be feeling irritated or uninterested in things that used to get you excited. Maybe you're just not feeling like yourself. There's a good chance this is related to changing estrogen in perimenopause or menopause. Now, if you still have your uterus, progesterone is essential. It protects the lining of the uterus from overgrowth that can occur when estrogen or estradiol is used alone. So if you have your uterus and you're using estradiol hormone therapy, progesterone is not optional in that situation. And the form of progesterone that we prefer is micronized progesterone. This is a bioidentical or body-identical progesterone, and it's better tolerated than the synthetic versions. It tends to be a little easier on the mood and has a more favorable safety profile. It's also an excellent sleep aid, helping you to fall asleep better and stay asleep longer and get that more restorative deep wave sleep. The 2024 American College of Obstetrics and Gynecology review shows that micronized progesterone has not been associated with increased risk of breast cancer, has not been associated with increased clotting risk, and is generally easier on mood and on breast tenderness compared to some of those synthetic versions of progesterone. And this is why modern menopause specialists like myself prefer micronized progesterone for women in their hormone therapy. So what are some of the reasons why you would want to take hormone therapy? When estrogen declines, every system in the body feels it. Every system is affected. Your brain, your heart, your blood vessels, your bones, your skin, your pelvic floor, and absolutely your libido and sexual response. Hormone therapy is really about maintaining your health, maintaining your vitality, and maintaining your quality of life. It helps to dramatically reduce hot flashes and night sweats. It helps to preserve bone density and reduce the risk of fracture. It helps to improve vaginal and urinary symptoms, and it helps to reduce cardiovascular death when started early. So that's deaths from things like heart attack and stroke. And in some cases, it has been shown to reduce the risk of death from breast cancer when estrogen is taken alone after hysterectomy. And studies like the Danish Osteoporosis Prevention Study have shown up to 52% reduction in cardiovascular events when hormone therapy is started near menopause. How do you know if hormone therapy is safe for you? The primary indication or reason for systemic hormone therapy is hot flashes. But there are nearly 100 symptoms of menopause and perimenopause that are related to low levels of estrogen. So even if your primary symptom is not hot flashes or night sweats, you may still benefit. There are 4 main steps to take to know whether or not hormone therapy is safe for you. Step 1 is to look at your age and the time since menopause. Hormone therapy tends to be the most beneficial for women who are within 10 years of menopause or under the age of 60 and are experiencing moderate to severe symptoms. That said, age alone doesn't automatically disqualify you from hormone therapy. There are many women over the age of 60 who continue or maybe started on hormone therapy, but it does depend on your individual profile. So personalized care with your doctor or other medical caregiver is going to be very essential. Step 2 is to determine if you have any contraindications or reasons why you can't take hormone therapy. And there are quite a few things that we need to look at. Questions that a medical professional will think about are things like, do you have an estrogen-sensitive cancer? Do you have or have you had breast cancer? Do you have or have you had endometrial or uterine cancer? Do you have heart disease? Do you have other cardiovascular disease? Have you had a heart attack? Have you had a stroke? Have you had a deep vein thrombosis or a blood clot in the deep veins? Do you have liver disease? Do you have unexplained vaginal bleeding? Do you have any blood clotting disorders? Do you have any of the following conditions associated with blood clotting problems? Things like lupus, antiphospholipid syndrome, and factor V Leiden, to name a few. If you have any of those contraindications that I just mentioned there, it may not be safe for you to use hormone therapy. Certain situations where hormone therapy may not be appropriate are things such as active estrogen-dependent cancers, unexplained vaginal bleeding, active liver disease, or certain types of clotting disorders. When those types of cases arise and hormone therapy is not an option, there are alternatives and other options that are available to manage menopause and perimenopausal symptoms. Again, this is where it's important to talk with a healthcare professional who is versed in the different types of hormone therapy and all of the treatment options so that it can be tailored to your individual health history. The third step is to assess your heart health. Before I prescribe hormones to my patients, I always want to evaluate their heart health first. I want to find out about their cholesterol. I want to evaluate their blood pressure. I want to know if they're taking blood pressure medications. I want to know if they smoke or hookah or vape? Do they have diabetes? All of these points are important to think about when evaluating and assessing their heart health. And step 4 is to assess your breast health. The main thing here is you want to make sure you're up to date on your breast cancer screening and mammogram. What are the different forms of hormone therapy? For estrogen, it can be taken as a pill, applied as a patch, applied as a gel or spray, or can be used vaginally for localized symptoms. Progesterone is often taken orally and sometimes can be delivered through devices like an IUD. Each option does have its place, but it really does depend on your particular risk factors, your symptoms, and your preferences. What is the preferred route? In most cases, I recommend transdermal estrogen, which is the patch, the gel, or the spray. And I like to pair that with the micronized oral progesterone. The reason I prefer this combination is because the estradiol is not metabolized or processed by the liver, which actually reduces the risk of blood clots forming and tends to lend itself to more smooth, stabilized hormone levels. And the oral progesterone taken at nighttime not only helps to protect the lining of the uterus and prevent abnormal changes in the uterus, but can really aid with improved sleep and restorative sleep. So this combination is something that is really well tolerated by most women and helps make a big difference in their lives. So what are some questions that I get all the time about hormone therapy? What blood tests do I need to get before starting hormone therapy? There is a misconception that we need to get hormone levels in order to determine the amount of hormone that needs to be replaced. It doesn't actually work that way. In most cases, we don't need hormone blood tests in order to diagnose menopause. Menopause is typically diagnosed by clinical findings or the symptoms that you have, rather than with laboratory tests. That being said, for my patients, I will typically order blood tests to check on other possible causes of the symptoms and to make sure that hormone therapy is safe for them. And this includes checking the thyroid health with a thyroid stimulating hormone test or a TSH, and looking at heart and liver health with things like a cholesterol panel or liver enzyme tests. Because if you have problems with the heart and or the liver, that can make it unsafe for hormone therapy use. Does hormone therapy cause breast cancer? This is a big one where there's lots of confusion around it. So I want to talk about what the research actually shows. There was a large study called the Women's Health Initiative, and it first looked like the combination of estrogen and progesterone increased the risk of breast cancer. But later, researchers found that this really was not the case. The concern came from unusually low breast cancer rates in the placebo group and not actually higher rates in the treatment group. When estrogen was used alone, like in the case of those women who had a hysterectomy and didn't need progesterone, the results were actually very surprising. When estrogen was used alone, it was linked to a lower risk of breast cancer and a lower risk of dying from breast cancer. Other studies that looked at estradiol alone also showed similar results. So overall, the data suggests that hormone therapy, especially estrogen alone, does not increase breast cancer risk the way people once thought, and may even lower the risk in some cases. Is it too late for me to start hormone therapy? The answer to this is not necessarily. I actually have a whole separate video on this very topic that I'll link below. As I mentioned before, ideally we want to start hormone therapy within the 10-year window of menopause and under the age of 60. But there are some instances where we can start it and even continue it after that age. Will estrogen and progesterone hormone therapy help my libido? Well, estrogen and progesterone hormone therapy are not specifically prescribed to treat libido. However, many women do notice an improvement in their libido when they're on estrogen and progesterone hormone therapy. And this is because when we have proper hormone levels, we see levels of stress decrease, we see inflammation in the body decrease, and we can see blood flow and lubrication improve. And ultimately, this increases your natural capacity for motivation, desire, and libido. So what about testosterone? Testosterone has become an option for improving desire and sexual well-being. Its use in women is off-label, but nonetheless, it is becoming an emerging option that some expert clinicians do provide. Not everyone is well-versed in how to use it, but it does exist as an option. According to the American College of Obstetrics and Gynecology, a trial of testosterone therapy can be used, usually a transdermal preparation like through the skin, like a cream or a gel, and this can be considered for postmenopausal women who have low sexual desire after other possible causes have been addressed. It's important to note that there are currently no FDA-approved products for women, even though there are many options available for men. So when we use testosterone in women, the dose is much lower, and it's typically about 1/10 of the dose used in men. Monitoring is also going to be very important and a key factor in the use of testosterone for libido in women. It may be worthwhile to check testosterone levels prior to starting hormone therapy with testosterone in women, but we definitely want to check it anywhere between 3 to 6 weeks after initiation or starting of the hormone therapy with testosterone to make sure that the levels are not too high. We want those levels to stay in the normal range for premenopausal women and not go beyond those levels, because that can cause some side effects that are unwanted. So overall, testosterone can be an off-label option, but it needs to be used carefully at the right dose and with the proper follow-up. Let's talk about our desires for a moment. Low libido, decreased interest in a partner, and loss of interest in intimacy are common problems that women over 40 experience. And many women also find that things that used to bring them interest, things that used to bring them joy and excitement, activities that used to bring them pleasure, no longer feel as exciting or as interesting as they once did. Your libido, your motivation, and your desire are not just about hormones. They are biopsychosocial. Simply put, that means they are influenced by your biology, your mind and mental health, and the cultural, social, and community support that you have around you. So for women over 40, when we see those changes in hormones, like any other transition, it requires full support. Hormone therapy is just one tool, and for the right person, it can be incredibly impactful. But when the right hormones are combined with the right mental and community support, the results can be truly transformative. That not only gets you feeling like yourself again, but it allows you to expand into a new kind of vitality, where you have renewed interest, heightened sensation, and emotional vibrance. If you're a woman over 40 navigating hormonal changes in your libido, changes in your interest in your partner or interest in dating, or things that used to interest you in general, you might be dealing with sleep disruptions or hot flashes or just not feeling like yourself. And you're ready to get your pleasure, your health, and your life back on track. I want to invite you to click the link somewhere around this video to learn about the system that women over 40 are using to navigate this transition, to wake up their pleasure and live their best lives for now and the years to come. Thanks for watching, and I will see you soon.